Welcome to our virtual event on overcoming healthcare hurdles. I'm Adriel Bettelheim, Senior Healthcare Editor at Axios, and I'm coming to you from Olney, Maryland. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join today's conversation on Twitter with @Axios and hashtag Axios Events. Over the next 30 minutes, we'll examine the challenges and solutions to eliminating healthcare deserts and expanding equitable access to care. Our first guest is the American Heart Association's Chief Executive Officer, Nancy Brown, joining us today from Dallas. Welcome, Nancy.
Hi, good morning, Adriel. Good to see you. Thank you for having me as your guest.
We're happy to have you. You know better than most how social determinants of health have a significant effect on a person's risk of developing heart disease. How much of that is behind the rise in heart disease rates that we're seeing?
Yeah. It's such an important question, and thank you so much for asking it. I might just say that at the American Heart Association, addressing the social determinants of health, in addition to all of our work in understanding the disease and addressing risk factors, is really a priority for the organization. We believe very strongly that where a person lives, a person's access to healthcare, a person's access to safe places to play and to exercise, a person's access to having the same economic advantage as others in other neighborhoods and parts of the community plays a big difference in a person's overall health and well-being. And of course, with heart disease rates on the rise, we know that these social determinants of health are partially responsible for that. Alongside the social determinants of health, of course, are lifestyle issues like obesity, and other forms of access to medications, which can come right back down to the social determinants of health. We also know that during COVID, many people delayed getting care for their cardiovascular symptoms, and that also could be having an impact on these rising death rates.
So what does an organization like yours do to actually narrow the gap in disparities?
At the American Heart Association, we're so committed to narrowing the gap in addressing disparities of health for all people. One of the operating constructs we have at the American Heart Association is our impact goal. And we're operating right now under our 2024 impact goal that states that we will improve health outcomes for all people, focusing especially on access to healthcare and access to high quality healthcare as being a real pillar of that work. When we created our 2024 impact goal, again, because we believe that every person deserves the opportunity for a full and healthy life, we made a number of commitments, 10 of them, as a matter of fact, that focused on investments that the organization is making to address the disparities in this country. These investments include $100 million in new research programs on science-based health inequities. We are funding programs in rural America, understanding the health disparities in rural America. We're focused on the very devastating impact of maternal mortality in this country. We're focusing on the prevention of hypertension. Each of those are $20 million investments the association has made in the last 3 years. We also are working to build the pipeline of diverse, devoted young scientists who will be driving the future of scientists. That's one of our 10 commitments. Another one that I might mention that I think will be of interest to you and to your viewers is that we've invested $100 million new dollars in community-led solutions, breaking down the social and economic barriers to health in communities across the country. We know that driving change at the community level is really important because where people live and where they work is so important to addressing challenges that people face. So those are just a couple of the commitments that the association has made.
You mentioned how the pandemic exposed many of the deficiencies and barriers in the American health system. What was maybe the biggest lesson you learned or the biggest surprise?
Well, sadly, I think the pandemic exposed what we have known all along at the American Heart Association is that there are structural inequities that have long existed in the healthcare system that need to be addressed so that every person everywhere has equal access to experience strong healthcare in this country. The American Heart Association is addressing this in a number of ways. First of all, through our quality improvement programs in over 2,400 hospitals in the United States, we recognize some gaps in our own program. And so we have invested $4 million new to expand the network of hospitals that are part of our quality improvement program. We know that also addressing the root causes of structural racism in the healthcare system is important, and we're focused on that as well. We have had a 50-state Medicaid expansion strategy where the American Heart Association advocates across the country have been focused on expanding Medicaid so that all people have access to high-quality health care. And then I mentioned rural health before. Not only are we studying rural health in our science and research programs, we're really focusing on adopting and expanding telehealth programs to make sure that people can access care without having to drive long distances for in-person care. So all of this, has been a major priority of the association's 2024 impact goal, and we're very proud of the progress that we're making.
Your organization had volunteer advocates on Capitol Hill last week, meeting with congressional offices on SNAP, the Supplemental Nutrition Assistance Program, the Farm Bill, and other issues. We know the cost of food's rising, SNAP emergency allotments are history. Do you feel your message is getting across?
We're very energized, always by the power of volunteer advocates visiting their elected officials. And last week, you're exactly right. We had 100 volunteer advocates who were part of our national You're the Cure grassroots network visit Washington, D.C. We had more than 100 meetings with congressional offices to emphasize the need to protect the SNAP program in the upcoming Farm Bill. And this is important because we know that more than 40 million people participate in SNAP, and the majority of SNAP benefits go to households with children, older adults, and those with disabilities. And with the SNAP emergency allotments ending and the cost of food rising, vulnerable populations are really in a tough situation. And we need Congress to know that making adequate SNAP benefits is more important now than ever.
And did you feel that this debt limit agreement sort of sets the stage for some more deal making down the road, or what's your take on the news of the week?
Well, we remain optimistic that our elected officials will care deeply about the 40 million people in their voting communities that participate in SNAP programs, and we will continue to work tirelessly to make sure that their stories are told.
Well, it would be remiss having the American Heart Association here and not talking a little bit about the near tragedy we witnessed on Monday Night Football with Damar Hamlin. Having an incident like that in front of an audience like that so unexpectedly, what has that done in terms of inspiring people to learn CPR, other such things? What's your kind of perspective on the fallout from this event?
Yes. Well, you're absolutely right. I mean, that was for all of us who were watching, seeing those events unfold, you don't forget something like that. And, proudly, the American Heart Association, as the worldwide leader in resuscitation science, training, education, and advocacy, we were ready to jump in and help translate to the American public and to the worldwide public what was happening. And the thing I would like to make sure your viewers recognize is that when the world saw Damar Hamlin's cardiac arrest on Monday Night Football, what they also saw were those very first links in what we call the chain of survival working. Everything happened like it should have happened in a cardiac emergency. Early recognition that something was wrong, dispatching 911, first responders on the scene, having access to and using an AED after high-quality CPR was administered, and then being transferred to a hospital where quality can be delivered. What we know, though, is that the facts are really devastating, and we're so happy that Damar has made such a great recovery, and we're so proud to work very closely with Damar on educating the American public about the importance of learning CPR. But the unfortunate reality is that only 1 in 10 people who experience a cardiac arrest outside of the hospital each year will survive. And to put that into context for you, there are about 400,000 out of hospital cardiac arrests a year. So that means 1 in 10 of those people actually survive. And there is a way to fix this. The way to fix this is to make sure that everyone everywhere knows how to administer CPR. You can learn hands-only CPR by visiting heart.org/CPR and watching a 2-minute video on how to do hands-only CPR. But always remember to jump in and take action, call for 911, start CPR, and you too can save a life.
Well, thank you, Nancy Brown, for joining Axios today.
Thank you so much. Have a great day.
Next, we have a View from the Top segment.
Hey, thanks, Adriel, and thank you to our sponsor, Walmart, for making this conversation possible. And joining me now is Walmart's Senior Vice President of Pharmacy, Kevin Host. Kevin, welcome to Axios.
Thanks, Chris. Glad to be here. Thanks for having me.
Absolutely. I'm excited to have you and to talk to you. I want to jump right into it. My first question is, what is Walmart doing to increase access to healthcare?
Yeah, absolutely. 90% of the population is actually located within 10 miles of a Walmart. And about 4,000 of our stores are actually in medically underserved areas. So, at Walmart, we really feel that we're in a unique position to provide health and wellness services to all Americans. So many of the underserved communities that we serve today don't have adequate access to healthcare, but they do have a Walmart pharmacy staffed by a pharmacist or a technician who understands the local health needs. So, we do understand that health is more than just simply going to see a doctor. It's a combination of factors, including personal behaviors, clinical care, genetics, even social determinants of health. So we also know that care requires coordination across all these aspects. And at Walmart, I think, we're able to provide omnichannel access or care through multiple methods, including our pharmacists or virtual care or brick and mortar clinic sites. So we're trying to also address things like fresh food, personal behaviors, just all in one location.
Yeah, I want to talk to you a little bit about that because you mentioned the sites and having a number of different places there. I wonder, how is the industry innovating to meet what are really evolving needs of patients, particularly after the pandemic? I mean, things have really changed.
Yeah, you're absolutely right. I mean, the view of pharmacists has just fundamentally changed. I think throughout the pandemic, people now know the value of pharmacists right there in their community. In fact, a study from Columbia showed that over 63% of provider respondents really agreed or strongly agreed that pharmacists should play a greater role in preventative care activities. And so, several of them also agree that pharmacists will ultimately be employed in primary care practices, allowing for even more direct collaboration between, the healthcare teams, doctors and pharmacists, namely. But I think when COVID-19 happened, we were already there. Pharmacists were already there in the local communities. We had relationships with thousands, millions of customers, and we're already a trusted voice in those communities. So the pandemic really had the impact of demonstrating the importance of pharmacies as that community resource and how we can take care of the people in those communities. So, for example, we've actually trained more than 15,000 of our pharmacy technicians to administer vaccines and have really helped expand their expertise within our pharmacies. We've provided a lot of training opportunities, and we even have a free pharmacy technician training program for our associates who want to join our pharmacy teams. I think today with 2 out of every 3 COVID-19 vaccine doses are actually given at a pharmacy, and pharmacist interventions during the pandemic really helped save about $450 billion in direct healthcare costs and avoid about 1 million deaths and 8 million hospitalizations during the pandemic.
And I think one of the things you brought up there, Kevin, was the trust that the community has in Walmart pharmacies and pharmacists. And I wonder, kind of, how are Walmart pharmacists filling that gap in rural areas that are facing healthcare shortages, like a shortage of primary care, for instance?
Yeah, absolutely. As I mentioned, we've got more than 4,600 pharmacies nationwide. Many of those are serving just the heart of rural America. So our pharmacists are present at every store, and they're armed with credentials from APHA or from the American Council for Pharmacy Education, and they provide convenient health resources right where people are already shopping just every day for groceries and essentials. Our Walmart pharmacies too are known for providing affordable prescriptions. I think our $4 generic program is legendary, if I could say that. We also have a full suite of vaccines from COVID-19 to flu, shingles, pneumonia, and many, many more. On top of that, healthcare screenings. We can check for blood pressure, for cholesterol, A1C for diabetics, and more than that. So, and we've got probably one of the biggest assortment of over-the-counter medications, vitamins, supplements, and supplies. So we're there 7 days a week. We have convenient options for patients to come in and get access to all the healthcare resources that they may need. We even have same-day delivery for prescriptions and, refills via text. So, ultimately, I think the role of pharmacist is also expanding in many locations. Pharmacists are in that really unique position, and a number of states have actually increased the scope of practice for pharmacists. So we can do testing for things like COVID-19, for flu, for strep, and we can actually prescribe treatments or provide treatments in many states. The list is small, but growing.
No, and we have just about a minute left here, and I don't want to let you leave without talking about the specialty pharmacies, because Walmart recently opened a couple of specialty pharmacies focused on treating and preventing HIV. And I just wonder why, kind of what's the impact that they're having, and what might the future be for specialty pharmacies?
Yeah, absolutely. I think, we were trying to take specialty pharmacy out of that central fill paradigm and put it into these communities that I'm talking about. And we've focused on HIV because even though there's been a lot of progress made in this disease state over the last 4 decades, there is still a stigma attached to it. And 1 in 3 people that are living with HIV aren't even on regular treatment. What's more than that is it's preventable. We can provide PrEP therapies for patients to prevent the transmission and spread of this disease. So last year, in partnership with the Elton John AIDS Foundation, we launched a prevention and treatment continuing education program. And by the end of this year, we will have about 80 sites open across 11 states, including states like Colorado, Nevada, Tennessee, and many, many more.
All right. Well, we have to leave it there. We are out of time. I could continue this fascinating conversation. Kevin Host is the Senior Vice President of Pharmacy for Walmart. Kevin, thank you so much for joining Axios.
Thank you, Chris.
And now, back to Adriel.
Thanks, Chris. Our final guest today is the Executive Director of the Patient-Centered Outcomes Research Institute, Dr. Nakayla Cook, joining us from Washington, D.C. Welcome, Dr. Cook.
Thank you so much. I'm glad to be here.
So you're a cardiologist turned clinical researcher, now leading PCORI and focused on funding comparative effectiveness research. Tell us how that kind of work fits into the broader efforts to address some of these persistent health equity issues.
Well, PCORI is a very unique research funding organization, and we seek to empower patients and others with the information that they need about their healthcare choices so that they can make the best decisions for themselves. And we're focused, as you mentioned, on comparative clinical effectiveness research, which is when 2 or more different approaches to healthcare delivery are examined to see what works best for different people in different circumstances. And we really do need CER just to understand what works best for people in different situations. So at the core of CER is this recognition, really, that not all patients are alike, not all treatments or interventions will work the same for everyone. And by comparing these multiple approaches to care, we can provide the evidence that's really relevant to a person's particular situation. I thought I'd just mention, I grew up in the stroke belt in the southeast of the United States, and health disparities and social determinants of health that really affect health outcomes were really prevalent and prominent in this area, where stroke and heart disease and cardiovascular deaths had disproportionate burden in this geography of the country, as well as for certain racial and ethnic populations. And this is just exactly the type of issue that PCORI is working to address through comparative clinical effectiveness research, and our commitment really to achieving health equity as one of our national priorities for health. I thought it may be helpful to share with you that we think broadly about health equity. And when we're talking about race, ethnicity, geography, gender, or even disabilities.
Have the results of your work tangibly changed the practice of medicine or mitigated disparities so far?
Well, for PCORI, equity has really been a central focus for us since the beginning. And the way we tend to think about patient-centered outcomes research is that it's inherently connected to equity. It really involves taking into account the voices and the lived experiences of all people. And results from comparative clinical effectiveness research that we've funded have been uptaken in a variety of resources, and patient and public-facing resources like Wikipedia, health blogs, or other types of material, but also in a lot of point-of-care decision-making tools, and nearly 150 or so citations in a very useful decision-making tool called UpToDate. But you also see results from CER and things like policy documents, guidelines, meta-analyses, and things of that nature. I thought it may be helpful to tell you about a particular study that was recently published in the New England Journal of Medicine called the PREPARE study. It was conducted by a team at the Brigham and Women's Hospital, and it compared two different asthma treatments amongst 1,200 African American and Hispanic adults who are disproportionately burdened by asthma morbidity and mortality, and also historically underrepresented in the types of clinical trials focused on asthma management. And now our national asthma guidelines call for daily use of an inhaled corticosteroid to control and reduce asthma exacerbations, but the acceptance and adherence of that practice is generally low, particularly when people are challenged by their life circumstances to adhere to such a regimen. But this research team actually found that by giving study participants just one-time instruction on adding the use of the inhaled corticosteroid when they usually use their asthma reliever, nebulizer, or inhaler on top of usual care actually lowered the risk of severe asthma exacerbations, improved asthma control, improved quality of life, and reduced the days lost from work or school compared to just usual care alone. Now, related to your question about uptake, we are now focusing on how you take results like that into implementing this new way and approach into a way in which an implementation project will take this healthcare delivery method across 4 different medical systems in order to help expand the uptake of these types of results to really improve outcomes amongst those that may be disproportionately burdened by asthma exacerbations.
So socioeconomic status, where and how you live, and other factors outside of the clinical setting are certainly relevant to public health. Tell us other ways that PCORI is incorporating those into what you're studying.
Well, we're looking for innovative ways really to make progress on strategic priorities, especially around health equity. We've recently actually introduced health equity impact supplemental funding to certain eligible projects that PCORI has funded to try to address the key goals of increasing really the diversity and representativeness of study populations and funded studies, but also to really understand the issues and factors that contribute to inequity in health and healthcare so that we can focus on the types of interventions that will address these inequities the best. One of our recent funding opportunities that really demonstrates this well is our partner, maternal health partner funding opportunity. And I'll tell you why it's named partner in just a moment. But this has a very broad health equity focus. It's focused on Black or African American people, American Indian, Alaska Native people, Hispanic people, people with disabilities, residents in rural areas or in lower socioeconomic status, or of lower socioeconomic status, because we recognize these social determinants of health are important drivers of the disparities in health outcomes that we see. And we're looking for evidence-based solutions to improve and comprehensively address both the clinical and the social needs in communities that are impacted by these disparities. And the maternal health topical focus here really affects all of those populations that I mentioned. And this funding approach is partnering community-based organizations as full partners alongside research organizations, inviting that type of partnership, very full partnership and collaboration with communities to develop what we call multi-component interventions to address both the health conditions and the social determinants of health to improve maternal health outcomes amongst all those populations I mentioned.
You have used the term patient-centered. It's in the organization's name. Help the audience here and tell us a little more. What does that precisely mean and why that's important?
Well, many people ask us what's in a name, and patient-centered is really in the middle of our name. It starts it off because PCORI really sets itself apart by putting patient outcomes at the center of the research that we fund. And we know that healthcare research studies have traditionally involved patients predominantly as research participants. But what we're focused on at PCORI, and PCORI is really a leader in advancing research that's centered on and really driven by the input of patients and other healthcare decision makers who use the study results that are produced through our funding. So in PCORI-funded research, patients and diverse healthcare stakeholders are partners who leverage their full lived experience and expertise to make research more relevant and the research results more useful and trustworthy. We call this engagement, where we really begin in the planning stages of a study and continue engagement through the study conduct and dissemination of its findings. It also happens upstream just to help determine what the evidence gaps and needs are for comparative clinical effectiveness research.
Give us one example how the organization delivers the findings from research into practice at the patient and community level.
Well, this is one of the things that makes PCORI unique, and that's that our work really cuts across that continuum of research from the generation of evidence into the dissemination and implementation of that evidence to the hands of those individuals that need it to make the decisions important for their health and healthcare. We also support infrastructure that enables faster and more efficient real-world studies. And really, our release of new evidence begins with posting short and understandable summaries of all the research findings from the studies that we've funded soon after the research results are final. And you can find those on our website. We also have programs and activities that promote awareness of PCORI-funded research results to facilitate the uptake in practice. And as I mentioned, we fund dissemination and implementation projects to implement results from research that PCORI has funded into healthcare systems, through community settings, and in those scenarios. The study I mentioned, the PREPARE study, for example, has an implementation project tied to it to really now implement that strategy in 4 diverse medical systems. But we also have many other projects that are now coming to the place where research results are available, and we're at that phase that these implementation projects are starting to take shape. One that I'll mention around around mental illness, because we know the challenges that we have in this country with severe mental illness, especially just laid bare during the pandemic, is using basically a smartphone app and program to help those with severe mental illness manage care as part of their regular care at community mental health agencies. And this project is now moving from having results that show that that program works to now moving it out to more than a dozen clinics across 2 different states. And antibiotic prescribing, another area that Corey has focused on in terms of understanding the use of narrower spectrum antibiotics as compared to wider spectrum antibiotics in pediatric populations has shown that in certain scenarios, the narrow spectrum antibiotics work just as well as the broader spectrum ones. And we're now moving that into implementation, where we have an implementation project that essentially is across 115 sites, 5 different health systems in 3 different states. So that's what we mean when we say we don't stop at research results. We really want to get them across the finish line, scale them up, move them into the systems that can benefit the best.
Well, thank you, Dr. Nakayla Cook, for joining Axios today.
Thank you for having me.
Thank you all for joining us this afternoon for another virtual conversation that's made everyone smarter faster. For more on overcoming healthcare hurdles, or to sign up for our Axios Vitals newsletter, visit axios.com/newsletters or on the Axios app. Thank you all for joining today, and we'll see you on axios.com.